let me find that. I'd like to call the meeting to order at this time. And I have the commission look at the minutes to approve them, please. Should have gotten them in an email anyway.
But you have hard copies, Madam Chair, as well. And then, do you have extra copies of some of the public ones? Copies of the minutes? Does someone want copies of the minutes? Sure. Thank you. And there.
Make a motion.
See, you can't.
Make a motion to approve the minutes. Anyone else?
I second.
Second, call for the question, all in favor? Not opposed? Motion passes. Minutes are approved. We go on to public comments. Anyone?
No one has signed up. We do have members of the public, but also part of the stakeholders, the providers. There is a section for them, but at this time, Madam
No
Chair, they
signed
can
up.
also make comments if they so
Okay.
wish to.
Let's have the report on data for local resources and needs from UTRGV interns.
Okay, about you, these are just two drafts of, I didn't get enough for everybody, but we did get them.
We emailed them.
Okay, so this is, the directory, the resource directory that,
Is
scan,
this the same thing?
Yes,
The one you all
yes,
emailed?
yes.
Okay, we got it, yeah.
so,
The beginning of table of
Okay.
contents.
the two interns, well, the three interns that I have right now, they went ahead and contacted all the agencies and they got, most updated, resources based on, all this information that they were able to get, which is one of the assignments that we were asked to do. So,
I was able to, with one of my clients for the UWA court, we were able to review that, and she was gonna look over and find out
Okay,
what
sure.
benefited her, so
Yeah.
it's really good information.
Good.
And again, Madam Chair, we thank the interns, and they're still working on the additional work of going back to the stakeholders and update their services. And then, they're only here till August, but I think they're gonna initiate some of the cost analysis,
Yeah.
and then we can take it. What we did, based on your input when we sent it out to you, organized it a little bit. Your version is the organized, new organized, and this is the table of contents where you wanted tabs in the different groups. We're gonna send it back to the stakeholders to see that they're in agreement that that's where they fit, that these are the services. But it was a feat, and so, thank you to Scan who did the original that was archived through Crime Stoppers, because we got the original from Crime Stoppers, and then the interns updated it. I don't know, Jaime, if you have any other comments from, that they felt they
Yes,
saw?
one other thing they did, we're able to contact, one of the, providers that a lot of the local providers here, do, use for services for, detox and residential. The place is, Charlie's Place, I think you all mentioned it last time. The cost, and this is a, 500 per day, 2,500 for 5 days. That's for detox. The residential is 200 per day and 6,000 for 30 days. Outpatient, that is, 2,700. And then for 3 months, it's 24,000. So, and, their services are Tuesday, Wednesdays, Thursdays from 6 to 9. So that's what I have from that, program where they were able to get that information. They haven't done any other contacts to any of the other, entities, but that's what we have so far.
They had on there, they accept insurance?
They accept, insurance, they accept Medicaid also.
I reached out to them too, that they accept, I think, Blue Cross and Aetna also. I don't know how much that helps, but they're very expensive.
Yeah, and the thing is like, for example, when my daughter was sent, she was sent, I guess, through the state. So, sometimes that helps, you know, but again, you know, it's not a lockdown facility, so
No,
they can meet,
it's not a lockdown.
and she left.
Madam Chair, if I may, that's a good point that Ms. Intel is saying, is and I think the providers can attest to it, certainly Border Region is the mental health authority, that we don't have enough beds, we don't have enough local and resources for transitional support, for ongoing treatment, and then for follow-up. It just isn't, and today we were talking to Congressman Cuellar's office on support because the president's budget to the Centers for Disease Control did appropriate, and we're waiting to see if it's a if it comes out in the final budget of 40 million for opioid and substance use services. Most of it for treatment, a little bit for housing and transitional services, a lot of it going to the state for the cooperative agreements they already have with the federal agencies, primarily CDC and SAMHSA. They have what they call a cooperative agreement with the states, and they give the states the money, then the states through their mental health and substance use agencies then do RFPs and give out grants, and I know SCAN is one of the grantees, so we're glad they're on there because they will qualify. What we told the congressman is that the cooperative agreements base it on formulas, and the number one indicator is population, so that already hurts us. And so for them to urge the state to consider us need and border, and so he's gonna get back to us, but at least one agency will qualify in responding to the proposal from the state when they issue, because they already got the money. And so that'll help, because that'll increase, but the need here, I think, is more. And so hopefully he can make a change with the state, and then we're waiting to see if there are any additional funds that also come down, especially for detox. Unfortunately, none of the monies right now are for brick and mortar. So, unless you all have heard differently from the stakeholders, Madam Chair, to acknowledge Ms. Colina Rodriguez, another commission member, just came in. Thank you for coming.
Thanks for coming.
No, I'm sorry, because just for the sake of the rest of the members, Rodriguez had another commitment, but she had called and said, if you need quorum, call me.
Thank you.
I called her and she came, so thank you.
Yeah, no problem.
Did you give her?
Well, my question was, are any of these places allowed to take in people that are illegal?
That's
Undocumented? I don't think so.
That's a different
No.
question, we don't.
Well, because simply in my neighborhood, out of the 12 houses in my cul-de-sac, 6 never answer the door to do the census. And they come to my door constantly. I'm like, I did mine. Leave me alone. I don't know who lives there. I can't tell you anything. I don't know. So there's a lot of people that have moved over here because of, you saw the newspaper today,
Yeah.
you know, all the problems they're having over there. And so we're not really the amount of population that they say.
good point. Good point. We've been making it to the different funding entities, the Congressman Cuellar at the federal level, to the legislative, the state legislative caucus, Senator Safarini and Representative Raymond, and they're with us, they support and they advocate, but they're outnumbered.
Yeah.
They're outnumbered, but at least they make it official by stating the border needs to be looked at for its
Yeah.
uniqueness, for its border needs, for its health needs, for the lack of appropriate resources. Again, because I was asked by the new deputy chief from Congressman Cuellar, what's the difference? And I'm saying, well, one, look at just heroin. It's easily accessible on the border. And so for us, then addiction, so treatment. But also, if we stop it on the law enforcement, then it doesn't go further. But we need resources for that. And so she took that information. She was gonna share it with Congressman Cuellar.
Because they count, and this is just me thinking in the back of my head as you're talking about this. They count and say we have 12 million or 20 million or how many illegals they say we have. They count them for that.
Yeah.
Why can't they count them for when we need help?
Good point. Madam Chair, good point.
And I don't wanna get elected. Or I would go fight it, I'm too old. If I had been younger, maybe. But, we need to make that point to our representatives whenever you get a chance or email, because I get emails and calls from Cuellar. And would you like to join in whatever meeting that they have at night and all of that
Yes.
stuff? If you all get called into that, mention it. The illegals are counted for their purposes, but not for ours. Where we're the ones, everyone that's allowed in, then where do they go and eat from and where do they get all the help? And we're already poor and they're taking what should be for
Assigned.
ours. And you have to feed them, you can't say, no, go away, go die.
No, point well taken. Point well taken.
I'm sorry.
No, point well taken. Madam Chair, thank you to the interns. I don't know, you all requested the directory to be updated of what kind of resources, so the interns are still with us if they need to do changes. Certainly, we emailed it to you. We added a table of contents. We're gonna send it back out to the stakeholders now for them to comment too, so we can come up with, I think it's important what you all have wanted to do is to develop a directory of services in the community.
But a living one that continues to change.
Yes.
Yes,
Living one.
yes. I don't know if you have any other comments, recommendations, just wanna look at it some more.
No, I mean, I said, we've already, put it to use. I mean, there are things in there that I didn't even know, and I'm involved in,
Yeah.
in whatever aspect and capacity that I'm involved in. That's amazing, great work. I'll recommend that.
Well, we thank Ms. Rodriguez, she brought it from Crime Stoppers over, so thank you, Ms.
Yes,
Rodriguez.
it's all living done with the archives.
Of course.
Well, it actually, it came from SCAN,
SCAN.
be part of the Webb County Community Coalition. They sent it out to everybody, all the members, and I took a look at it and I said, look, this is,
Exactly
we
what
don't
we
have to redo it, it's just adding on
Right.
and putting it out there. My recommendation is that since the directory's already there, maybe just continuously updating it, but maybe creating a brochure, a trifold, brochure with all the information or all the services that are provided. Maybe, and it's real simple because it has the counseling agency, so maybe one fold will say counseling agencies, and then just the very basic as to why you would need a counseling agency, then the substance abuse services agencies and organizations, and maybe a brief summary of what, and then maybe the Drug and Alcohol Commission seal, the City of Laredo seal, the Health Department seal, and all the stakeholder seals. And then for more information, contact the City of Laredo Health Department, and then this directory would be able to be used by customer service to allow them to, I guess, and in similarity to what 211 is, 311 is that you're providing that information to anybody who needs to be navigated through these agencies.
And to be put where, because she was saying about how we didn't know and my daughter had no access to it in where she was.
Juvenile or jail,
They need information there because the parents have no clue where to go now.
Well, you're absolutely right, Ms. Rodriguez, and the rest of the members and chair, because one of the groups, once it's finalized, and it's ever changing, it has to be updated, but when there's a draft that everyone's comfortable with, The other group that needs it, cause they get calls statewide and regionally, is 211. 211 gets the calls, where do I go to send someone who has X problem? And actually the city's 311, but 211 is the state network.
State network.
And you all use it all the time, they have your information from Board Region for the crisis centers. And so I've just briefly talked to them to update this, and they knew of it and said, if it's being updated, we want it, because they're 24/7, the call center for 211.
And I spoke to Miss Elizabeth with 211, and they every year they send out for updates, but a lot of people miss those updates, and so this information's not updated. So maybe we can resolve to say every year, you know, maybe in January, having to look, just review it and
An updated one.
update it, yeah, every year, and then we put out the publication in a month, and then we go on from there. Something that just has a standard that, the commission agrees that every year we'll review it and send out for updates. And I would recommend, I know that in November, places change, people are changing, so maybe in January, coming about it, and then we review it every year on an annual basis.
I think excellent idea, Madam Chair, and then always going back to the stakeholders, that we want vigilant service
Right.
providers is to also check it. Again, for the record, Commissioner Moncada is also here, the commission member.
Yeah, sorry, and coming from one class to over here.
Oh, we know.
Well, the only thing that I was going to mention is that some of these may be under different tabs, they would still fit under the different tabs, so we need everyone to look at it to see if they wanna be under another tab.
Exactly.
Because you provide something else.
Yeah.
And then just if I may, as a recommendation, Mr. Lozano, I know that you put up the Facebook page, maybe putting out a post really quickly and saying if there are any services that provide in this categories, please inbox us for your information. And maybe that would allow small groups that are nonprofits or maybe mom and pop board
Right.
or
Or
churches
churches,
or whatever that have something that they can add to that directory, then we put it out there, and if they didn't respond to it, then that's that.
Good idea.
And then that can be shared through Laredo Crime Stoppers, maybe the city health department and the city of Laredo. Just a small post that says, if you provide the services, in such and such, please inbox us, so that we're updating our directory, blah blah blah, and then go on from there. Just an idea to to utilize the social media. And then if I may do a recommendation, on post for the Facebook, maybe feature maybe one of these agencies every week, or
There's a lot, so.
and then that way people say, we don't know, but if they ever go back to the Drug and Alcohol Commission Facebook page, all that
It's on there,
information's
we'll see it.
on there.
That's a great idea.
I
I'm
don't know,
still
there
learning
it
how to
is.
use the Facebook, but I'm gonna.
I'll help you with that if
we'll
you'd
do
like.
that.
If you want, add me as an administrator, and then I'm able to schedule posts and publish them, and all we need is, just a little summary that is already on the directory as to what they do. We'll just, copy and paste and maybe tag their pages or their websites, and they can get scheduled and then published on its own.
On the Facebook, can you, I guess, look through that and make sure that it's done right? Cause I think I did it out of, my private account, so that's like kind of attached to mine. I don't know if there's a way to do a brand new one.
Well,
Yeah.
you don't want to do a new one because you've already shared it, but maybe, I don't know how it would work, but maybe the city of Laredo can get a DAC at cityoflaredo.ci. Whatever the website is, the email is, but maybe getting that one and then linking it back to Dr. Gonzalez, and then accessing it, and then you can become an administrator, and then I can become an administrator,
Okay.
and then when our tenure is done, they still have access to it and they continue it.
Okay.
So we can do it like that, but we would need to add another administrator. That way it links back to the city of Laredo.
We can work with them.
Great. I have such smart students. Just my student too.
Oh.
So with that directory, I guess this this index shop compiled is gonna go in there, so they can navigate a little easier.
Right.
And again, just, who are all of our target recipients for that booklet? We have 211, we've got the providers themselves, and anyone else? It's gonna be a
Can you
recipient
be
to you.
provide, because I remember asking you the question when my daughter was there, hey, what do I do? And you're like, I don't know. There's scan and just a few things you mentioned, but basically said there's not much, so maybe we can give you so that you, I know you're on the prosecutor side, but so what, you know, you can offer help to the
Yeah.
parents, and so that way you have a list to give the parents. Because I know I'm not the only parent that asked you.
Well, I think you have an organization, well, you have a branch, where you actually help out, DWI victims, right? And he's with an organization that we send people to.
Like probation?
Yeah, you know, of sorts.
In some capacity, yeah.
Mm-hmm.
Those providers should receive a copy too, but I
As
was
well.
wondering, are we also gonna make this available to the general public if they so choose to have it?
I think so.
Or is it at your discretion?
And on that note, Mr. Thompson, I want to say early June, I had a meeting with the Criminal Justice Division. We get grants, and we were talking about how there's, and I mentioned that I was part of the Drug and Alcohol Commission, and they were talking about how there is so many coalitions and commissions, and there's all these people that are all for the same purpose. And when I mentioned Drug and Alcohol Commission, it's led by the City of Laredo, they said, you know, we were talking about it, and I want to be able to, I asked them for a list of all the coalitions and commissions that they know. That way we have a report of what is going on. I know that there's like a homeless coalition. I know that there's a Webb County Community Coalition. So these coalitions, the small coalitions that are throughout the month, we can give them this information, letting them know that we have a Drug and Alcohol Commission and that we serve the purpose of helping the community, so that if they report it back to us, that we'd be able to bring it back to the table and bring it back to our city council members. But I think the community would take advantage of this brochure, and all these commissions, coalitions, and you know, all these people that are on here, just so that they have something that they have reference to. So I mean, at this point, anybody and everybody. Yeah.
Do we do flyers too? Like, you know, I mean, flyers would be more cost effective along with the brochures, and we can visit the Webb County Coalition meetings, pass them out. We can go to schools, pass them out. They're just a lot easier to mass produce and to shoot out.
What we could start off is that we can ask Ms. Veronica at the coalition that maybe they allow us to speak in regards to what this commission is doing, and then invite them to give us their feedback on how their services are doing, and then we can bring it back here and say, look, it's working, it's not working. I mean, it just opens up more doors and opportunities for other people to get involved. But one of the things is, why reinvent the wheel? And so there's coalitions and coalitions and commissions, and they're all for the same purpose. They're all trying to solve a problem. And so if we acquire that list, which I did ask the criminal justice, it's the South Texas Development Council who is in charge of the CJD grants. I did ask them if they could provide a list of the meetings, when they meet, and what coalitions there are. And that way maybe we can reach out to them and provide this information to them.
Well, I was just thinking, to build on your idea of the brochure, I like that idea, and it'd be nice if we had that little brochure, but why not, instead of just referencing it, why could we put a link and just, so anyone can just go to the website, just click on the page, and they'll have an electronic version of it. I was thinking.
However, a lot of the kids that are on drugs and so on and so forth may not have.
Like, let's say at the jails, we have a captive audience at the juvenile detention center, and at the jail, to where we have enough of these agencies to not have to go and look for an audience. We have a captive audience there. The people there who most need it more than anyone. And as far as I know, and in my experience with my daughter from 16 to 26, she didn't have any Buddy go in there, like all these different agencies that exist, and saying, don't try to go look for people everywhere. There they are. They're right there. They have nowhere to go. So if we can make it a point to get, I think you already said that we had permission. We just need to get the people there. So that's a start right away before anything gets done. I mean, these people, that's what they do for a living. Why have we not reached out to these people already? You know, so we can't do anything about the past, but let's just stop getting off on merry-go-round and let's go do something right away. Let's go talk to, you know, however many people you have in jail in the juvenile or in the jails right now to get them on their road, on the right track, because I didn't have that, or my daughter didn't have that access or benefit. Instead, it's basically, you're in jail, you're punished, you're no good, you're never gonna be good, and that's what they're fed in jail, and that's all. They need more bad people in jail instead of, hey, you're a drug addict, we need to help you. They're lumped together, and they end up being criminals when they were not before. So is there a reason why you all haven't reached out to these captive audiences?
A lot of these institutions supposedly have their own service providers within. I know that tomorrow Pillar has a meeting with several of the local judges to try to start providing inroads, working with those populations, but again, that's just the beginning of a conversation.
We have
that should have
permission,
been
he said,
had.
you just gotta get with the sheriff, there's no more red tape, it's gone, it's done. I think that's what you said, we're talking to the sheriff said, let's do it, let's go, but if you got too much red tape, and we'll talk here and there and get everybody else involved, it's there, it's done, there's nothing to talk about except, hey judge, or hey sheriff, we're here with this group, and we're that group, and we're the other group, and we're gonna come on Monday, and this group's gonna come on Tuesday, and this one's on Wednesday, and this one's in the morning, this one's in the afternoon. I mean, the girls won't even get to go outside.
I can say this though, for example, with the health department, we have certain grants that fund the work we do. And there's specific language in those grants that we are not to serve people that are incarcerated. As sad as it sounds,
That's
it's true.
wrong.
I can only tell you what's on there. That
Very
doesn't
wrong.
mean the desire is not there on behalf of the staff. It's just that's the written language within the scope of work we're supposed to follow through. Then when you look into the other potential providers within the community, at the very least, you start looking at funding opportunities to provide the professionals to go in there. And so that's another obstacle that needs to be circumvented, because at the end of the day, if you are not getting funding to work with that population, to do it and not have some kind of compensation reciprocated for the service becomes a challenge within itself.
So like the Chicas group that you brought, I thought that was the service that
Right.
they would be providing.
Right, and again, that's in the infancy stage, and hopefully one day we'll be having a very different conversation. For now, it's not something that's functional because it's just starting.
For Pillar, but
Correct.
not necessarily the rest.
Right, no, I'm just
of it, yeah.
speaking for Pillar, and obviously I made a statement regarding the health department. as
I don't
well.
know how Scan or whatever.
Yeah,
And
But-
Madam Chair, Scan's gonna present in a minute, they're working to make a comment, but Border Region, I don't know what capabilities and services you provide.
You know, I know that we have a jail diversion program, I don't know the details of it, but as far as, I mean, Border Regionals, I know that you're familiar with Border Region, and
Yes.
we basically, as far as what we provide, we're limited as well, because we provide our services to the Border Region patient or client, okay? I mean, I love your idea, I think you understand what we've been through with my sister,
Mhm.
same thing, never, had any clue, and it was up to us to figure out where we were gonna send her. And so I understand that, but as far as
Well,
Border
they're a
Region.
captive audience,
Yes.
but so you have all this red tape and trying
Yes.
to get all these people
Yes.
to come, and it's like, it's nonsensical to me, because there is,
You've got
when they're
them there.
most desperate,
Yeah.
and they will be more eager and wanting to get the help than when they're back out.
That's when they need the information.
That's when they
they're
need
in
the
there.
information, because it's
Yeah.
like, oh, okay, this is here, and oh, well, maybe I should take a look at it. I don't wanna be living this lifestyle anymore. Oh, you all even exist. Oh, you all don't think I'm trash. You think I can do something with my life. Oh, you're gonna teach me some skills. Oh, you know, whatever, but what I heard, like.
Well, and to remedy that, and it's sad to say, but I totally know that that's what happens when there's grant-specific items that only allow you to do or provide services to certain demographics. It's unfortunate, but it may be different for all these other agencies. And so, maybe my suggestion to the interns is maybe calling and asking, you know, do you provide services to the jail? Would you like to provide services to the jail? And then to quickly remedy that, because it's going to be conversations. We're still in we're still in the process of getting the wheels, you know, rolling. And we go back to maybe perhaps providing a poster or a flyer at the jail, or when, you know, with the sheriff's permission or, you know, collaboration, is to allow them to get a flyer and they read. And it's up to them.
They're being
you know.
provided with some information.
That's the information that, and it starts.
There's a way you can, sure.
So if that's something that we could do, then that's just
That's
gets
a
us
start.
to start providing that information. What they do with that information, and I say it, you know, what they do with that information is their free will. Whether they want to take that opportunity to get help or not, that's up to them. But the information is out there. That is, again, our mission, to get and to spread that awareness. And that's how we could start.
But like you said, if a piece of paper is one thing, and let's say, for example, I'm giving you an example, when my husband used to go at 6 in the morning into the jail, that's when somebody was caught DWI, they're at their lowest point. They're either gonna admit that they have a problem or they don't, but even they planted the seed. Somebody called my husband an angel, you know, it's like, what? You know, but he's saying, you were here when I needed to hear this, because I wouldn't have, my wife's been telling me, everybody else has been telling me, but you came here at 6 in the morning and you cared enough to take time from your day, nobody's paying you, you're doing it because you want to, then you're really a service. Otherwise, you're just a paid.
If I may answer to piggyback on that, that's what I was gonna say. I know that this commission is looking at things from a macro perspective, but perhaps through the work of this commission, we can do things at a micro level by having this very resource guide, having everybody identify one person from each agency to form a committee of professionals or individuals with a history of working with individuals with substance use disorders to come together, create a coordinated plan to go into the jail. So all of a sudden funding is a non-issue because employees step outside their scope of work with permission from each respective entity to take turns going into these locations and render service, but a service where the blueprint is created by that committee of professionals, so we don't have rogue people going in there doing something that deviates from the coordinated plan. Maybe we can do something on that level.
And Madam Chair, if I may, then, you already started serving services, and how do we enhance? There was initial, in the follow-up question, the entrance to the providers and stakeholders, is that, are you providing to the jail? That's gonna be a follow-up question, or what do we need to do that? You already discussed certain proposals. We do have another agency here, I don't know if you all, Westcare is doing anything in the jails?
No, not currently, no.
Okay.
We're not doing anything in jails, I mean, we're working with 406, if they send us participants, or potential participants to our, to provide services.
But then, so I think that's, you know, and Manuel already alluded to a potential activity. The other thing is talking again to Congressman Cuellar and saying to the funders, to SAMHSA, to NIH, to NIDA, to CDC, don't be so focused in the grants, because they are. But allow us, when you're looking at substance use and behavioral health, we gotta go to where, we've seen it with HIV, and the jail is, we see it in TB, you gotta go to where the at-risk population is to prevent and treat.
That's right.
And so we gotta go to jail, and do services there. But commission members, the first step is your directory that you all ordered, and that's gonna be information. It may not help the person with addiction, but the persons in the jail now know I can send some to here.
Yes,
So that's a step,
yes.
that's a step, so we'll, I mean, this is coming from you, we'll keep working on this,
And again, I
sure.
think back to also, I mean, when a question is asked, to have, you know, the deputies or someone there at the jail that's gonna have the answers, you know, because otherwise, they're just a bunch of questions that go unanswered and they leave, and so if they could get some information,
Mhm.
better than none.
Or like a side, like you say, and a lot of them, they don't have access. I mean, they might go to the library, or some of them, they're not gonna
And
do
if
it.
they're in jail, they can't go to the computers.
But like say a person like my husband,
Mhm.
he's one of, I don't say, they may consider him one of them. He says, hey, I was where, not necessarily I was like exactly where you are, but I was similar to you.
Right.
So they don't feel like, hey, I'm above you and I'm here to tell you where to go. No, I'm here as your peer.
Right.
And I'm here to offer you what helped me. And this is behind me now, but I was where you were, maybe, you know.
And peer-to-peer efforts tend to have, yes, a
Yes.
higher
Impact,
success
yes.
rate than sending a professional that they may not be able to relate to.
So then can we,
Recruit from the
Make-
groups.
first of all, make those brochures as fast as possible, and flyers too, as he said. Flyers first, then work on the brochure as fast as possible, ASAP yesterday.
And even there, like at the jail, they say, hey, when I'm talking to her, when you're there, it says, call over here for sexual abuse or whatever. But it doesn't say, call, maybe we can have something on the wall like that says, call over here for these services.
Correct.
Or that website that you said, and it'll link you to everything, you know, or
Madam
talk
Chair-
to this person.
Madam Chair, and members, Border Region already has a crisis list, and it's got all of you on there already. That could be an immediate that we can make a brochure to spread, but it has scan, Border Region, it's got
Everything we have
pillar.
on here, because is it updated as good, as well as what they.
But their title
listed?
is crisis, which is,
Yes.
yes, this is a crisis, so we could do that until everybody reviews this updated. Even the way it is now, and Mr. Lozano said it, it's information that a lot of people
Yes,
I
don't
didn't know
have.
about, I didn't know about it.
I mean, believe it or not, people still don't know about Border Region and what we do. It's like, you know.
Yeah.
We find that as well.
What is
Right.
The scan, they've
Wow.
been here for longer, it's still people
They
sometimes don't know.
What do you
Yes.
do?
Mhm.
You know? Yeah. So information is key
Come
for
through
them.
this one, great.
Yeah, I like that idea of providing something that's already there, because with the brochure and everything, if we're gonna send something out, I wanna make sure that we send it out right. And I like the brochure idea a lot, because it's a starting point. I mean, you wanna have these volunteers, you wanna have these experts, you wanna go into the jail, well, you know, if at least we have a brochure for them, they have something physical to start the conversation with. And, I like the idea of this directory being linked on that brochure, because maybe the addict doesn't have access to a computer, or doesn't
Family
wanna do
does.
this, but their mom might, or their brother might, or somebody else receives the brochure who wants to help them money. So I like the idea of having that link to a electronic version of our product here to the general public. And then we have it at these various places too, and they can all grab the brochure, pass the brochure out. But what I was thinking about too is, who is our target audience with brochure? And when we know who the target audience is, I'd like to have a representative of the target audiences review the brochure as it's being created, so it's user-friendly to all the different target audiences. You see what I'm saying?
Yes.
Because I was looking through it and I was confused myself. I usually get confused on a lot of things, which is no surprise, but and it didn't have the table of contents, but I saw like there were multiple entries for scan, which was kind of confusing. The way that it was formatted, it didn't look like it was in alphabetical order.
So
Or,
that's why we need to tab it, right?
Yes.
so that's why we need to have some people go through and you know, our target audiences analyze, give us some feedback on it, and organize it in a way that's going to be user friendly to them. But yeah, I mean, just to kind of summarize, I really like the brochure, and I want that on there. Also, be nice in that brochure if we had just some common sense facts from the last year. If we want to do this yearly,
Right.
it's like, hey, this many people died
That's
in Webb
right.
County because of opioids, or the like. Just maybe 5 or 6 real quick facts to get their attention. Have that a link to this product on there. And, I would like to know who's gonna receive it, so we can maybe already start to get some locations around the city where we're gonna pass these brochures out or have them available, like public libraries, the different counseling agencies, the jail, courthouse.
The detention center.
Detention center for them. It would be nice to know locations where we're gonna post them at, and immediately we can get the ones that are already prepared in those locations to kind of check it, see how they're working out, perhaps. And then I wanna get it in the hands of these target audiences for them to review it and
Well, Madam Chair and members, then if you want, we can promote the crisis list that Board Region already has, that has all of the emergency numbers of the different stakeholders and providers, while we send the directory back to the agencies for them to review as well.
Okay.
We need their input too. And once we get it back, then we have an updated directory, and then we can start looking at the target audiences that you're saying, that who's gonna review it. Because I agree, they need to also, the users need to review it too. Is this user, we may think it's the greatest thing, but the people gonna use it, and that's why immediately one of your recommendations was to divide it and put tabs and so it's not so cumbersome going through it.
Right.
Yeah. And also, just to put some deadlines on here, some tentative deadlines. Again, this is an annual project that's gonna go through, but Drug Awareness Month is April. I think we need to have some type of deadline for January, just to have everything together.
That's right.
And we need to plan on releasing these, or releasing a version of it on, in April, because that's our target month, right?
Right.
October is drug and April is alcohol.
Or
So-
April's alcohol.
Yeah,
So,
April is alcohol and drug is October.
They have December's impaired driving awareness.
So we can, I mean,
It's all year.
yeah, and that's why I said every month we can consider what month we're doing, and maybe we can come up with a campaign for that particular month. I think because for the sake of the commission, and I know that, new council members come in and then they assign new commissioners, so they come in January, so then we'd want to hurry them up to assign somebody to come on board, and then they come in January. Their first task is to look over the directory and then put it out there. So yeah, the first one can definitely be put out in April, because it all links back to alcohol one way, shape, or form. And then then later in October we can revisit it and promote it even more. But throughout the year, we can definitely do that. And having to do the brochure is for the general public. And right now that you said, Mr. Lozano, in reference to the jail, and we can put it in as part of their commissary, let's not make it very hard for them. And I love the idea of, maybe putting out a sample and seeing if maybe an inmate would pick it up or would read it or would do something with it. But I can honestly say that maybe a trifold brochure with information might turn them off, and they may ignore it. So maybe something that can be slipped into their commissary, and it's a front and back, English and Spanish, with those facts, with those things, and it's just an attention grabber.
Parents go visit, like the parents.
Well, and that's another form, and again, because we're reaching different demographics, we need to reach out in different forms. And so for the entrance of the jail, or at the booking area, maybe there's a different flyer, there's a different poster. I mean, we can go on and on talking about it, but there's different demographics that we need, and we need different print and publication for it. But yes, primarily is to ensure that we have the directory up to par to however we need it, that it is accessible for 211 operators to link into whoever's calling and saying, I have, my son, daughter who has this problem, who can I call? And then they can go and then say, these are the people that you need to call, and they reference them immediately. And yes, the brochure I think would be a fantastic idea for the general public, with brief information about, I would call them fun facts, but they're really not fun facts. But counseling agencies. Why would you call a counseling agency, and maybe something that's factual. Then the substance abuse services, and it goes on and on. So we can definitely, I think we can definitely put something together and say, who do we wanna reach out? Yes, going to the demographics, okay, we wanna reach to the jail inmates, to the jail parents, to, service providers, agencies, and then the general public.
The students.
And
Start
students.
when they're young, JJ.
That too.
and all that.
And then reaching out to the, JJAP, to the,
Ms. Mojica.
Ms. Mojica, yes, and anybody who has, at-risk individuals or who works with at-risk,
Just as a point of clarification, Madam Chair, members, because yes, you're dependent on the elected official, only 2 members of the commission currently will be affected. The rest of you 4 are gonna stay for 2 more years. You 4.
Oh, okay.
The 2 that may, we don't know, depending on the election, would be you 2.
that's why I said whoever comes in.
Well, we gotta
But-
get
but
her
you
in,
still
we
have
gotta
quorum.
get them in anyway,
No,
somehow
no.
or another. But we make a quorum, you're saying?
The new or who, in your case, yours is term limited, so yes, in your case, he may be reelected. And so you will stay on until they have, someone will have to appoint. You 4 have 2 more years.
Well, I like the simpler versions you're talking about, just the front and the back, it's
Yeah.
easier to produce.
Mm-hmm.
Perhaps what we could do is, when we have a link to this directory, maybe underneath, we could say, for assistance with the directory, call 211.
Okay.
Because I had no idea about this 211, it's just a surprise to me, I knew 311,
I do it.
I know a 911, but I didn't know a 211.
And this
There's
is
a
a great
411.
idea
Yeah.
on the 211, because in the last couple of months, and like I told you last time, Chief, we referred a couple of people to Border Region. Because they called us, we don't know, so I just, hey, Border Region sounds good. And they've been able to help them, so they're getting counseling.
It helped the jail too, in as far as the guards go. I mean, I used to be a guard, and you have crises a lot, it helped to have them handling these
Yeah.
brochures and this information, so
Sure,
they know
right.
how to better service somebody, instead of just, call 211 and find out, they can address the problem. Maybe call somebody, I don't know how late people plan to be open, has to work overnight, but
Well, there's crisis lines that you have to call.
Yeah.
That's the most important, to find those crisis 24-hour hotlines for local help, because most of them are for out of town. And the great thing is that we have his support, at least to go to the jails, and he has support now, from the sheriff's department, right? To get into the jails with these different groups, as long as we have permission and pass all the background checks and stuff like that, for us to go and visit with them, whether it's in the morning or evening or whatever.
Yeah.
I know church groups go sometimes,
Madam Chair, because of time, and I don't mean to cut off the discussion, and Scan may have another commitment,
Oh,
so
okay.
if you wanna allow them to present, you still have some items, but if you wanna
Yes.
allow
Just go
Scan to
ahead.
make their
Yes,
presentation.
and, well, thank you so much, and I have actually some, we brought so that y'all can have it as part of, you want to pass it on, please. So here, and that way we can go. So,
Did everybody get one?
Okay.
We hit the middle.
Okay.
So, first of all, I wanted to make sure that I introduce my colleague here, Enrique Manrique, and myself, and Gabriela Perez, so I put the cards here just so that you all have a reference and for more information that you may or any more questions. But basically, I wanted to just go over about SCAN, and like I told you, I was mentioning that even though we've been here for more than 35 years, 36 years sometimes, you go out there and SCAN and they don't know. So yes, we certainly need to continue to let our people know about the services. So just basically, we've been here since 1982. We have over 30 programs, and we have our main location at 1605 Santana. And we have been providing services for like I do for more than 30 years, and we have right now approximately 200 employees. And one of the main things, and I agree with one of the things that you were mentioning in terms of how we have so many programs that it can be confusing. And I agree that I think it would be a good idea to kind of be able to outline the basic services so people don't get, what is that program and what is that program? Well, basically, if you go to our major areas, if you look at, we basically have whole programs that deal with prevention and intervention, and we do go out there to the schools and basically is for individuals to prevent substance use, or if they have started to experiment, so we go and provide interventions as well. And we also have substance use disorder treatments, programs, and we'll talk a little bit more about those. We also provide services to survivors of violence, both domestic violence and sexual violence. We also have another really good program that's to treating child traumatic stress. So that will be like on the counseling part that I think will be good for people to know that we do have treatment for specific for trauma treatment. And we also have an emergency youth shelter and recently a transitioning living program as well. So those kind of are our major service areas. I'm not gonna go too much on the prevention and intervention. I would like to, so that for the basis of time. But I would like to just kind of focus on the substance use disorder treatments that we have. So we have outpatient services, both for male and female youth and adults. So we have those programs for this population. We also have residential treatment services for male and female youth and adults as well.
I can explain a little bit on the outpatient.
Yes, and then go ahead.
So basically, SCAN, there's a misconception that SCAN is basically known just for substance abuse treatment, for drug counseling. That is not the case. Right now, yes, we specialize in substance abuse treatment, but there's, like she was mentioning, prevention, intervention, crisis programs for violence, traumatic stress. So we have all that. Right now, because we are part of the treatment team, we do focus a lot on the drug treatment component. So when we talk about outpatient, we're talking about individuals that come to our office normally about twice a week, and they receive what we do call talk therapy. So they meet with a licensed counselor on a one-to-one basis, in group count also. Now, these services exist all the way from here in Webb County all the way to Cameron County. So we have offices throughout this area. All the services in outpatient counseling for youth are free. We also have adult services in Webb County and some other areas using technology. Again, those services are free. It's no charge. We do not ask for a legal status. So that is something that is not an issue for us. Now, in outpatient counseling, like I said, for adolescents, to qualify, we focus on the indigent population for people who have difficulty paying. So if you have insurance, we most likely will refer you to a private provider, and we'll focus more on individuals that don't have the insurance, things like that. So we work with adolescents 13 through 17 as far as outpatient counseling. Adolescents. Now for adults, we have face-to-face counseling here in Webb County, again, free services. Now one of the best parts of this particular project is that we've augmented and provide technology-assisted care, which is again outpatient counseling, but now we're able to reach other counties, surrounding counties, where we use technology as a way of doing counseling. Again, and in this particular project, we provide the individual, if they don't have the means, we provide them with a smartphone with a data plan, free texting, all these features at the agency's expense. If they lose it, they don't get charged for it. So we're trying to bridge the gap for those individuals that have difficulty accessing treatment, especially in the rural areas. We've gone as far as Kingsville, Harlingen, but the therapists are located here in Laredo.
We promote your program with our DWI and drug offender classes when we offer the resource lesson. They're so impressed. with all of that.
Is that tech?
This is the
Yes,
tax program.
Yes.
We work closely with the DWI project. So that is the outpatient counseling for adults and adolescents. you were going into
Yes,
the.
and we are also Medicaid providers as well, so if they have Medicaid, we also provide the service.
And we do have a specialized project, an outpatient for females.
Yes, so we also have a specialized female outpatient program, and we're also have fund, we have a federal grant that allows us to expand and provide transportation for clients, and it's focused on preventing HIV and hepatitis, so we're able to provide transportation, like I said, and a lot of case management and additional services. So that's basically, and we work very closely with referral sources such as probation, Department of Family and Protective Services. They make a lot of referrals to our services with Border Region, and so we definitely are, work together with all these agencies. And in terms of the residential treatment programs, we have the adults, and they're here in the south part of Laredo. We have the adult females, the adult males. We also have for youth, males and females as well.
So definitely, we have 5 facilities for residential treatment.
Is that Serenidad?
Serenidad male for adult, Serenidad females for female. 2 adolescent male facilities. One is located in Webb County. The other one is located in Harlingen. And finally, yes, those are the 5. And then we have a female adolescent program here also in Webb County. So we do have 5 residential facilities for substance abuse treatment. Now, all these facilities are free to the community.
They're free.
And we do take Medicaid. So normally when somebody does come with insurance, again, we do link them to a private provider. So individuals that don't have the resources to pay. Outpatient counseling is expensive no matter where you go. Residential, you don't have money.
Most cannot
Yes,
afford it.
most cannot afford it. So these facilities, we are very, very fortunate to have these 5 facilities, treatment facilities, within our community.
How many beds do they?
So the adolescent project has 8 beds for girls.
For girls.
The boys is 16 bed capacity, Harlingen and Laredo. 12 bed facility for adult females and 18 bed facility for males adults.
It was 24, but it was reduced to 8.
It used to be 24. We reduced it to 18.
What's the waiting?
Now, that's the thing. With residential facilities, there is a wait. There is a wait list.
Several months.
At times, it could be, but it really depends on the facility. Some facilities, like recently, the one I oversee the adult residential, and sometimes the person can be there quite a bit. Now, there's changing circumstances. The thing is that sometimes we have priority population. You may be number 5 on the wait list, but if we get 3 individuals that are IV users, all those 3 people will go ahead of that individual. And so then your wait list, your period of waiting gets extended, and rightly so, people do get upset. But we do have a priority population that we have to serve. IV users, pregnant female IV users, things like that.
Yes.
But sometimes the wait list is a little bit lengthy, at times it isn't. Just 2 weeks ago, we went through 6 individuals on our wait list and we couldn't get any of them in. And then all of a sudden we got people in, and now we have 50 people waiting.
Is it because it's not locked down, they can leave?
Most facilities in Texas, if not the United States, are not locked down facilities. These are owned by either for-profit or non-profit organizations. I know that there's been discussions that lockdown facilities, normally that tends to be more with the criminal justice system as part of their programs.
Right.
But treatment facilities, for the most part, will not be locked down.
Well, and I have to say that from experience, my sister's been there several times, and the wait, it was gonna be, she tried Charlie, she's been there, done that.
Yeah.
But Serenidad was awesome. She's been there a few times. The wait was not as long as most
For
people
women,
would think
it's
it was.
the waiting.
Yes, and the
It's more
service was,
males
the
have
quality
more
was excellent. She's been clean for 3 years. It's a great place. And again, like I said, you're gonna get a waiting list, especially if you can't pay for it. But it really wasn't, too bad.
How many counties share the Serenidad?
South Texas.
South.
Yikes.
So what is there, 19, 20 counties?
We've taken all the way people from Nueces County, all the way to Cameron County. We're even at a point, we've taken people from the San Antonio area. So,
So 18 beds are shared with all of South Texas.
There you go.
I wanted also just to add, because I know last meeting there was discussion about the peer specialist, how important it is, right? And so I just wanted to mention on page 6, we have a new program, relatively new, that's for youth right now. We're waiting for the adults as well, but it's what is called peer-to-peer services. So it's called SCAN's Youth Recovery Community Service, and it's located at Seymour, at 1303 Seymour. So this is, the whole idea is the peer recovery model that was discussed about individuals that have been through recovery, that are in recovery, that can serve as a support for young people. This is for youth 13 through 21. So this is already operating, and of course, this is DSHS funded, so it's completely free. Of course, for anybody that is wanting to get treatment or that has is currently in recovery, that wants to continue to get support. And we're hoping that that the adults as well. There's a new program that we're waiting for, that where we can also serve adults. For instance, in our specialized female outpatient program, we do have a peer recovery coach as part of our because this federal grant allows us to have this additional services, and I can say that it's a wonderful support for women. And we're conducting 12-step meetings for the women attending treatment, and she's definitely linking them to the recovery community. So certainly we're moving in that direction, and as I explained, I think the state is already looking into, certainly has been approved so that Medicaid can pay for peer recovery specialists. And I know they have to go through a certain certification and so forth, but I know the state is moving in that direction to integrate the peer recovery both for mental health and substance use treatment disorders. So
I just want to add one more resource, Texas DSHS. They do have a link of all the DSHS funded facilities within our area. So if you're looking for something outside, maybe in the Valley or Corpus area, or whether it's residential or outpatient, it'll highlight more.
Additional help. Also, I wanted to ask you about this transition living. I didn't know that there was such a thing in Laredo. That's what I've been wanting to.
Yes.
We used to have it. Then the funding ended, and then they put it out again, and we applied for
Does
it.
it exist?
Yes.
Right
It
now.
just started.
How many beds?
I'm not sure right now.
We'll
It
have-
was 8, I
We'll have
think.
to look and get back to you.
Yes.
on that.
Mhm.
It's under Cindy Vasquez.
Cindy Vasquez.
And
Cindy
it's
Vasquez.
from 17 to 21, that's
Yes.
it.
Yes.
You're not gonna get anything for older.
Older, no. No. As of now, no. That's yes. And also, just real quick, the other additional treatments. I mean, we're very very fortunate to have federal grants that allows us to do a lot of other specific services. So I just wanted to mention that we will have the offender reentry program. It's a federal grant that we should. It starts in
It starts in October 1st, the offender reentry program. What it will do is that it allows us to put individuals, therapists, that with individuals that are incarcerated, have been incarcerated and are about to be released within the next 6 months, to help transition from being incarcerated to civilian life.
Yes.
So we'll work with them with substance abuse, helping them attain a job, things like that. We even did bonds back then, so.
Yes. So
Um,
that's a new program.
That's
that
gonna
we
happen
started.
in
Is that like a sober house or sober living?
No, it's almost like an outpatient type setting.
Oh, outpatient.
Outpatient.
Is that 3 years or was it 5? 5.
5-year grant. Oh, yeah.
That's right.
Yes. I don't know if anybody has any questions.
I do.
Yes.
Just to have a snapshot of your services, and you describe them fully. Is there any way to find out how many patients in Laredo have been serviced, let's say, just in a one-year period?
Yes.
And there's a follow-up to see if they have
Relapsed.
with labs to it?
We,
or is it-
when you're asking about numbers, we're asking about treatment people served, correct?
Exactly.
Yes,
Just
I do have.
Correct the idea, because this committee is geared and the goal is, to push out services, and we'd like to also know, 3 meetings ago, I said, I brought out numbers of people that get arrested for possession of drugs. But now you say that this programs and services are available. How many people have been serviced, and then you guys follow up?
Yeah, so we
My,
do.
my second question is, when you do outreach, is it people that voluntarily go to your services, or you get referred by let's say, a law enforcement agency?
So let me, 2 questions?
Yes.
I'll try my best. So the first question is, yes, we do have the capability of giving you the numbers, the results. One of the things we pride ourselves is that we do have a follow-up. So when we treat individuals, once they complete the program, it's not over and done with. We do a 60 to 90 day follow-up. Then the federal programs also require us to do follow-ups at 6 months, sometimes 12. So there is follow-up with the individuals, and if they're not doing so well, then definitely we re-engage them. We do have our outreach people that do that. Your second question was?
Referral
Referrals.
sources.
Yes.
Referral sources, basically, referral sources come from not just individuals that want services, but through CPS and the legal system. So we do have a different variety, not one, at least with the population that I work with, comes to more than the others. Some, yes, definitely are on probation, but sometimes they come on their own. Others are required by probation.
would
Do
say
you do an
from-
outreach, that you go and knock on the doors, and look, I've been told that you have a problem, do you want volunteer services, counseling, therapy?
We're constantly in health fairs, participating with all agencies and promoting and serving. Definitely, it's part of what we do, but still, we have more to do.
As an example, there's a health fair by Texas Workforce this Thursday. We're gonna be participating with them this Thursday. Then Larga Vista has another one next Thursday, Larga Vista Community Center. We're gonna be with them. They offered us a slot.
Let me just clarify the purpose of my question here. I'm trying to connect the idea of the jail population connect to your services, the outreach program. My agency arrests on a weekly basis, an average of 120 to 150 people for various offenses. 25% of that is basically usually possession of narcotics. So the assumption of 20 to 30 or 40 people are, might be abusing. That's the assumption. All the ones that get arrested for burglary or theft, they're also users because they need the money and to survive. Now, if I give you a list of 20, 25 people that are constantly get arrested for possession, which is already an assumption, pretty much sure that the person is an addict, is an abuser, an address and a name. Your services, my question was, the follow-up is outreach programs to go and knock and talk on the door and says, look, we heard about your problems, these are our services that are provided, you're welcome to join us. Join the waiting list, we have therapies, counseling, group and this and that. Will you think that'll be feasible, is it, anything, can, take it home and think about it, of course, and not so the population in jail is a transitional population out there, one day you can catch so many, another day you can catch so many, but, once they're on the street or they go through our process, I already have a data bank of names, I already have a data bank of actors.
Definitely, we could work with you on that. I do foresee being swamped really, really quickly because of the amount of referrals we currently receive already from the different entities. However, Webb County or the area has a particular department that strictly focuses on doing screenings and referrals. They're known as OZAR. They're Texas Tropical from the Valley. They do have somebody stationed at border region, and their sole purpose is to do screenings. Is that the state funds us for SCAN. We get state funding to provide the treatment, but for screening and referrals, there's specific funding, and Texas Texas Tropical, they've been awarded that, and they have somebody in, Rudy Pais, stationed at Border Region, specifically, that's all he does. And we get referrals from him as well.
Because I imagine that even if you have a fair, or whatever you wanna call that, drug addict is not gonna walk off the street and say that they weren't fair.
But their families do.
The families. But then the family wants them to go, they may not necessarily want to unless they understand.
And normally it's a family member that calls us.
Yeah.
Yeah.
Yes.
It's always the
And we
case.
work with them and try to get that individual to come to services. If not, at times we go to them.
You have serviced, my daughter's been with you since, from 16 to 26. You've come to my house. You've sent other people to my house. She's gone over there. I don't know what's going on. That didn't stick. I don't know.
It's really challenging. Treating a substance use disorder is not simply, it's not a one-time deal. You come to us, you get your counseling, things click, and that's not how
Not a magic
it
wand.
works. It does take persistence. It does take working with the family, definitely. So it's.
If they
At
stay
some
home.
point it'll
I hope so.
You know, to add to Chief Torres's question, you know, they say that 70% of the criminals commit 70% of the crimes. If he gave you like a prioritized list of the worst that really needed the addiction more than others, is there a way to go and see them at the residence later on, or do something with those with that smaller number?
Well, that's a big question, and definitely the way I would address it is having a team, specifically with other treatment providers, not just ourselves, and getting together and seeing how we can do this.
A task force.
kind of like what we were talking about
So-
earlier.
And Madam Chair, that's what you all have been asking as commission members, and that's why the survey was important, to see how we support and enhance the services, because you've already heard from West Terra, you've heard from Border Region, now you've heard from UpScan. Even with the great work each one is doing, it's not enough. And so how do we come as a community to support that? And knowing what I mentioned earlier, that there's some policy issues at the federal and state level that also have to change.
Yes.
That they need additional resources, they need additional resources. 8 beds is not gonna cut it.
Well, let me share with you, really quickly, with the 8-bed facility with the female adolescents, sometimes we have difficulty keeping it up. We don't get enough referrals. So that's why sometimes we've gone to, other counties to fill the beds, so just 8 girls.
Well, I think, again, you all are in the fact finding, and Mr. Thompson said it well, the commission has to, and Chief Torres, get the information out. And so, I think that may change, because you've got now a commission that is asking, where do we send? Because they're getting questions,
And
and
again,
so.
services are free.
And I wanted just to summarize a bit, also add, through all these years that we've been operating, and I have had the fortune to been there 11 years. Kike, how long have you
About
been?
17, I think.
17. So one of the things that we're really, really proud of SCAN, and it is about that we are very passionate about constantly being trained on evidence-based practices and making sure that the level of quality of treatment is right there. We are trained in the best evidence-based treatments that are out there, trauma-informed. We're now integrating behavioral health as much as possible, because we know that substance use, is one thing, and then behavioral, we're now, integrating mindfulness, acceptance and commitment therapy, which is a wonderful new treatment, behavioral health treatment that we're integrating in all our programs. So one of the things that through our federal funds that we've had the opportunity, and we're very happy that we have good grant writers that have allowed us to have these trainings with the developers of all these models and really get certified and continue with fidelity and also adapting it to our community, making sure that it's culturally sensitive and responsive, and it's also language. We've had the opportunity to translate many of the treatment protocols that are part of that, and SCAN has collaborated on that. And we are very, and we also have a quality assurance that we're constantly being self-auditing ourselves to make sure that we're on top there. So we're really proud
Yeah,
of
no,
that.
and I really wanna take the opportunity, I hope I don't take too much of your time, that what Gabby, Mr. Flores, and I have, and actually myself, we have done is really just, not just work with therapists, but we try and help them grow in their profession. So we wanna focus on the quality of services that they provide. It's not somebody came in as a counselor, we give them a job, no. We really work with them, try to develop them, using these different models, whether it's ACT, whether it's seeking safety, motivation interviewing. Trauma will always be one of our base types of trainings that we provide, including motivational interviewing, but that's something we're really proud of. So we do.
But we still need to go back to Chief Torres' suggestion of if we get the list of the worst,
Yeah, I like that.
that would be a good place to
Thomas's
start,
idea.
to get them help,
Right.
and work on how we can get them out there.
If you have a vacancy, you could take if he
Yes.
pared it down, he could give you some suggestions, I'm assuming, I mean.
Because as soon as they get out, they're like a revolving door, they're coming right back in. I mean, that's the story of my daughter's life.
And those are the people that are definitely not gonna want it though, and they may have to be forced to go into,
That's fine. I mean, as a parent, that's where I'm going to the prosecutor, instead of the defense. You know, how's that? You know, it's like, prosecutor, help me put her in a place that I can make sure she's not gonna leave.
Yeah.
You know, because what can you do? I mean, as a parent, you don't wanna hope that the best place for her is in jail. As a parent, when you have your child going through that, and that's the best place in your mind that she can be, that's not good enough, you know. So I'm glad that we're all here to.
Okay, so what's our next step?
Yes.
Well, as far as you've gotten input from most of the service providers and stakeholders. Certainly from the directory, we heard loud and clear that we'll bring to you what is already established, primarily border region, but that has everyone's emergency number, so we can promote that. Work on the directory to send it out to the stakeholders so they can also comment, to develop a flyer and brochure at the end. So those we can work on, as well as to continue to advocate with our policymakers and flexing some of the rules and looking at Laredo for its needs, not based on population.
Right.
Because they need resources, or treatment, or transitional, or detox, which we have none. All of it needs the follow-up, the counseling, the evidence-based resources for staff development to have the right people. It's all I need. And we're not the only ones. Communities all across the nation are facing this problem. But our border has not had the equity and resources.
From here to Corpus to Brownsville, that's,
Yeah.
is it because we're Democrat and Mexican? You know?
That's why we'll keep on that, but I think the tangibles that you've already started, Jaime had to leave, who has the interns, because we want them to finish the follow-up survey to the stakeholders.
To organize this, you mean, yeah.
And to finish organizing this, so.
And can we somehow get into those questions with the interns to ask, how do we work with getting that list of the worst to get some help?
Right.
And start from there up?
Right.
Well, I wanna amend that, by the way, cause I think that probably the worst of the worst are the ones that they're gonna be so stubborn and
Messed up.
resistant, they're not
Messed
gonna.
up.
But maybe what your officers could do, maybe y'all could send out a memo or something, and y'all could identify the ones, maybe there could be criteria that y'all look for, like, poverty, youth that's disadvantaged, where there's a possibility that they could change, and maybe get a short list together of that and get it to them. Maybe that could help out to prevent them from becoming the worst of the worst, you know?
Well, I
It'll-
kind of
it'll be a
disagree.
difficult thing to
I kind of disagree
diagnose,
with that, yes.
you know, a potential success story out on the field.
Yeah.
You know how it is.
Because that
But
would
at
be
least we can
discriminating.
strive, we can try with a batch of 15 people that are not being arrested too many times, you know, they're career criminals, some of those. But the question still remains on the table that, once the list is created or the names are, is there someone or an urgency or scan is gonna go out there and seek them out and offer services? That's the main question. So as, you know, the numbers of patients serviced over 1 year, I think it'll give us a glimpse what has been the benefit to our local community, and that follow-up for relapsing or not, or success stories. It'll give us also some kind of a hope that there is a program that's successful in Laredo. There's actually lives being saved versus talking about the ones that are being constantly arrested or the ones that are dying every other month.
Yeah.
So let's just move on with that, you know, because my data bank is, we can, you know, click a couple of buttons and I'll give you, you know, a list. But what are we gonna do with it is
Do you have a contact person if we wanted to get information from your data bank?
yeah, contact me and I'll connect you. Yes, we can follow up with that, you know, meeting in my office, with my Intel people, but the key question is who's gonna be, you know, we're gonna be followed up and you know, outreach to them and see, you know, and you know, have, of course, a report of success or not, you know, how many people accepted voluntarily, and then just tab them into your patient list.
I think it's very hard to just do that, because as they funnel through these agencies, it's just hard. And in regards to Mr. Thompson's recommendation, I think everybody's at risk, especially when they come in once they've been arrested and they've been arrested for possession of controlled substance or anything that falls into a potential, they're at risk. If I could advocate, I would go straight to the JJAP, to the school campuses, to the youth village, and start them off there, because I know that Ms. Mojica had said that there was a lot of there's a lot of obstacles for individuals like yourself, and I think I spoke to you, that to go into the youth village. So I think with having to do the surveys and finding out if you can go to the jail, or the services can go to the jail, or they can go, and if I may, just to add to the interns, to the question, is if they can go to the jail, or if they want to go to the jail. And then the other one is, do they go to the youth village or the JJAPs? And they service that, because again, we're servicing adults and we're servicing youth that are at risk. Because I know that probably you have a list of people who have gone through the Laredo Police Department, to the Sheriff's Office, and it's never ending. And we go back to, do they want the help or don't they want the help? And at that point, there's nothing that we can do. But there are other individuals that may need it, or parents who may want to be able to help their children to better themselves. And so, if we can target, I mean, we target everybody, but it's a difficult thing. So,
because usually, if you're an addict, you say you want the help, but you're an addict, so it's not your fault that you can't. So that's why so they have to be locked down for a while till they can get traction again.
And so we'll add those questions to the survey and the follow-up to the stakeholders and providers. As Mr. Rodriguez said, and you all have said it in your previous meeting, this is a complex issue. But to the credit of the commission, to the credit of the providers, we've been addressing it. We've got to do more. We've got to do more, and we've got to come together as a community to recognize that this is a problem. And it's a disease. Because folks don't recognize it, that it's a disease.
And we do need to get the directory out there, because just as everyone didn't know that SCAN had put that together, and it was out there all these years.
I didn't know. Arcoiris, I didn't know.
We'll work at it. There is one item, because you all have been putting it off, that's it's a operational issue, you all have to make a decision on one of your members who has missed every meeting, and the charter says 3 meetings,
Oh,
and
that's gone.
you're out, so I just need a formal vote,
I will,
motion, and so we can notify the person.
She has the first motion,
Not second.
second, call for the question.
Real quick, do we know, I mean, does she have any desire to start attending, or is this?
no contact.
We've asked, she's gotten the minutes like all of you, she's gotten all the invitations, she's gotten the agendas. I know initially in the first 2 meetings, she did reach out to us that there were issues, but this is your 6th meeting.
No.
The protocol, the charter says 3 meetings.
That's what I asked 3 months ago. So, we have a first and a second call for the question, all in favor of asking someone else to be appointed in her place?
Who's that, Councilman, what?
Councilman Gonzalez's nominee. On that action as well, we still have Councilman Vidal Rodriguez and Councilman Bali have not named. And so if you all know someone, let us know. We've reached out to them that they have to, and now, Councilman Rodriguez needs to nominate someone,
And
Councilman Bali, and now Councilman Gonzalez will have to, because his appointee has not shown up.
If there's no interest, then we can't force them.
No.
So then, are you all in favor of asking them to appoint someone else?
Yes.
Yes.
Okay. Motion passes.
We had 2 people from Scan and.
Yeah, we have some people. That's already their job. All right, well then, since it's after 7.
Well, on this agenda, Madam Chair, it says there's a report by me in the detox center, just to let everybody know.
Okay.
I reached out to Judge Hale, he's interested in coming and addressing this body, perhaps next month, regarding detox centers. That's all I have.
That was what you already talked about, it's the same list that we have
Yes,
already.
yes.
So then, both people that were tasked with doing something have done it. Well, all we
Thanks
need now
to
is,
Colleen and you, and that did it for me, so.
we now need the update on the synthetic cannabis to be moved up to the next meeting.
If you'd like, Madam Chair, we'll defer that, we'll just send you an email, and just a quick is that it is concerning that the new synthetic cannabis is not cannabis, and it is causing very death. The people are overdosing. I did send you an article. In the past, the Centers for Disease Control is monitoring them, and we'll send you an updated one that says synthetic cannabinoids. What are they? What are their effects? People are dying. The same thing that Chief Torres and I have shared with you in the past, synthetic opioids. Fentanyl is we don't know their strength, and so people will OD faster, and the same amount of antidote. So this is just more an FYI to you, but we'll send this out to you again, and we can discuss it further at the next meeting.
Okay, all right, then with that, we will ask for a motion to adjourn. So moved.
Anybody else have any questions? Second.
Call for the question, all in favor? Thank you.
Thank you.
See you next month.